More and more patients are reporting long-lasting coronavirus effects. Some complain of ongoing fatigue or shortness of breath, and others of mental health struggles. For more, let's bring in Dr. Laurie Nadel. She's a psychotherapist and author of The 5 Gifts. Dr. Nadel, thanks very much for being with us. I want to ask about the mental health struggles some COVID survivors are facing. What are some of the long-term effects you're seeing?
People who have been sick for a number of months, some as long as a year, as you've mentioned here, anxiety, hopelessness, depression, and post-traumatic stress disorder. But the diagnosis of COVID is itself traumatic, and anybody who's spent time in a hospital, in an ICU, or intubated very often will suffer from post-traumatic stress disorder after coming home. One of the really difficult things is that this is a disaster of uncertainty, and we don't have a clear timeline for when it really started, and we have no timeline for when it will be over. So patients who get long COVID are kind of in this no man's land that seems to go on for a very long time with no real answers.
Well, many of these long-term COVID patients are turning to online support groups during their recovery. How is that helping?
We find that the Ultimate Pulmonary Wellness site on Facebook and the weekly support group that we give for long-haul COVID patients, that the community of people who are going through the same issues is really very helpful for people who are isolated by the illness and by the quarantines, by the fragility, by the chronic fatigue, and the difficulties in communicating with other people because of lockdown. And so everybody's isolated, but nobody is more isolated at the moment than somebody who's been sick with COVID for many, many months. And the online groups, again, Ultimate Pulmonary Wellness on Facebook, and the COVID Long Haulers Advocacy Project, which also reports on legislation and resources, really provide a lifeline for people who've been sick for months with COVID.
Well, why might some of these COVID long haulers, as they're called, feel they can't turn to family, friends, or medical professionals to discuss their symptoms?
Actually, they try to turn to people around them, but this is a very unusual situation because we really have no clinical data. This is a new disease, and people are very frightened of it. And so very often family members will get scared. And unfortunately, doctors don't have information very often, and they very often will tell patients, we're waiting to get more research. So patients have to be proactive. They have to become, and they do become, their own researchers. They become their own advocates. And when we come together in a safe support group online, we're able to share those resources with each other so that people no longer feel hopeless and alone.
Well, not a lot is known about the long-lasting effects of the virus, and therefore some doctors may not know how to advise patients who present with those symptoms. How do we fight something that we know so little about? What role do doctors play in this, quote, other side of COVID?
Well, I think that, from what I'm seeing and speaking to doctors, everyone is trying to learn as much as they can, as quickly as they can. There is a lot of information that gets shared among clinicians, both alternative functional medicine professionals, Chinese medical professionals, and also mental health professionals. We're constantly looking at research, we're constantly receiving studies, and doctors are doing everything that they can to learn as much as they can to be able to help people to recover both physically, mentally, and emotionally.
Well, these long-lasting effects could mean that we're fighting COVID long after the virus itself is under control. What are your biggest concerns, and how do you advise survivors who are experiencing these ongoing symptoms?
Well, I think the most important thing is to get, two pieces, information and support. Information and support are the best defense. Constantly ask questions, try to find other people who have survived and who are living perhaps with long COVID symptoms, talk to friends, get referrals and contacts, basically network as much as you're comfortable networking, and get support. and look up these online groups. Again, ultimately, Ultimate Pulmonary Wellness is the group that we work with, and I think have hope, because we're all in this together and we're all exploring and finding information together. Patients actually are our best hope, because they are the researchers who are bringing us the information about what it's like to heal and to recover.
Dr. Laurie Nadel, doctor, thank you so much.
Thank you.